Hello, beautiful peoples, dentists, and my friends, dental office manager. Uh, Good evening and welcome. I'm back and welcoming you to my daily um, live sessions where I speak about uh, dental marketing and branding, design, and today's topic is like a very special, it's kind of like emotionals that where I will delve into my journey, that how I got into this dental marketing space, and what is the relation behind, and the emotion and the reason behind that I took this path to positioning myself and solving these specific peoples, and the story behind. So as a like a branding designers, and how I like find my unique strength, it comes to like designing identity and telling a story. So it was not easy for me that it is like a kind of going to be a rough and long discussion session, but yeah, it's also be I want to like to be interactive as well. So I usually like typically try to like host this podcast like myself. It's a solo like video podcast, and the reason that I am holding this kind of live sessions daily, because of that uh, since I am trying to position myself as an authority, the marketer, right, in the dental space. So there, I really need to talk about this is topic, and that I am not from like the uh, like Western cultures. Even I don't have like the level of understanding the way they deal, serve the doctors and dentists, I mean dentists, like closely work with them. So there is a system. So since I am from like Bangladesh and like an Indian subcontinent country, so I am little bit of like uncomfortable. Let's say I'm planning to do make some like sales calls. So I don't know that their cultures and their demographics and the business operation systems, they have a different kind of procedure, different kind of system they follow. So, right, the cultures and the personality and the tonality is something that really matter. So I want to make sure that I really have that good understanding. I really have that sort of way, that understanding the pain points, the challenges that dentists have been facing or have encountered when it comes to running their practice, running their clinical journey, and how they like what are some challenges they get in terms of like positioning their business. So the core pain points, that how do I like enhance their problems, like through branding, like that I see that the problem is here, that I can see that the marketers, right? So marketing and branding in general, that what I found, that as a brand designers, I have been back in the day, that I was really involved in like designing things, and I just showcasing my creative concepts, and I didn't have any idea. I always kept in mind that there are some problems that I am solving, but the problem that I am solving, that was not like a real problem. I'm not like focused or identified specific peoples and specific practice owners and their business, that I'm problem solving the problems, like keeping the close connection with them and letting them know that what I am solving. It's like that pitching my ideas as well. So that sense of view, that I shift my mindset, and I was like discovering myself and trying out the market. That the purpose that I have discovered through my some of my personal uh, experience that I went through in the past. So which led me to like to pick this uh, like this is space of healthcare. And then I also like sub niche down a little bit again, that the dental practices And that, like before, I was like designing uh, things, designing stuff. Mostly I focus on like branding stuff. And I realized that there is something gap between like I am not making the genuine interactions with my ideal clients, with the dentist and the the founder, clinic founder, and the dental managers. Who they are like operating, the administrative people, so they are like operating the business size. The design is kind of form of like uh, solving problem, right? And the marketers is like taking the advantage of this. Like marketers, he knows, and he is like the marketers. You can see that I've been like observing myself that this part is covered by the marketer. So the marketer actually do the things for the designer. So because they get the connection with them and they know their pain points and they know their actual needs, and then they create the design solutions by collaborating with the designers. And when I shift this mindset, because that is my kind of like entrepreneurial choice, that I want to like start my business and start off like branding agency, that I will be like covering and those consultation as well, marketing consultation as well. Back in the day, that I do feel like that I was not have that marketing knowledge, but I have mostly I was focused on like design sense and design work. But yeah, but I was not happy, because that the personal, from as I went through that personal experience from my health, that I really know that how I'm gonna like talk with my ideal clients. It's not like there's something I know so much about them, but it is kind of like eternal connections. It's kind of like that emotional connections. It is intuitive connections, I would say, that is like instinctual. So I feel like that, yeah, I can do this better than anyone. And that, and what I was skip that part, that I was like posting. Even I can share with you, if I my journey the last 3 years, I have been like posting all everywhere about the design related of dentist and dental brand development. And I try to reach out also. I do some like outreach as well to the some peoples. But I saw that was not like time consuming, and yet I'm not have a close any like sales. And I was like getting more frustrated, but I was questioning myself why was not happening. And I then discovered that, yeah, I'm not positioning myself as an like an authority, right? And then I'm not speaking with them directly, and I'm not addressing their pain points as well, so they can feel that I really understand their problem, right? So yeah, I can see someone is watching the Skishimul. Hi, hello. So, so being said that I was not addressing their pain points. I'm not talking about with them. So I know that how to improve the design thing and how it solves problems, but it creates gaps. The when you do like as a dental practice owner or a dentist, that your job is like you do spend like hours, spend your every day and whole day on like practicing things and then improving yourself on thinking about the clinical stuff. But when it comes to like and marketing and something like that and design and branding, I genuinely believe that doctors are not going to think. Now I realize that they are not care about these things, but they think that how it is going to solve their problem. um, that's it, they know. And that part is dealt by a marketer, right? And marketer also do the collaboration with like designers. And when I like discovered this fact and discovered this way of like this process, then I shifted my I had to pivot my process. Even though I love that the things that the designing and crafting a story for the dental space, because of I see that the since that marketers, there are like, I know that 99% of marketers, they have a marketing sense, but when it comes to like the designing stuff things and designing things, so there are so many things they kept like not aware of those things, that the quality of distinctions they need to involve, they need to put on the project, on the designing thing, that a creative part that need to be fulfilled, and some level they need to consider like thinking professional ways, that that's need to be. So yeah, so I want to like discuss and like share this about that why do I really love to like working with doctors and dentists specifically, because I have gone through some personal health issues, like it's been like 5 years ago. I had a like I have a like chronic lungs infections, and now I am so recovered. And I back in the day that I was not aware about my health. Even if we know, I haven't any idea about like that our physical health and the mental health as well. Then when I like went through that battle, like 7 months of like healthcare uh, battle, right? And it's like medication, 7 months of consistent medications I had to take. And that somehow I got like recovered, and I feel like more happy. And the problem that I faced during that moment in terms of like getting the treatment and finding the right like healthcare partner and doctors and the like uh, like the treatment. So I was so exhausted, I was so disappointed, because the communication that that people really don't want to share their pains nowadays, because of it's every is aspects of like if you are like teachers, that students also don't feel like open to share their actual vision, actual dream. And that it is not easy to becoming like inviting and welcoming, creating a space for peoples, and giving them a space to share their story. And I know that the clinical staff and the clinical practice is kind of thing, and doctormanship, and that I do believe that that's the thing that here is also most of the things that dealing with the patients and understanding their emotional conditions. And most of the time I see that most people take hide their like some kind of like mental or the physical challenges, because they don't feel to share their challenges to the doctors. And they want to like get the treatment done in by surface level. That the reason that I found that is because of they don't feel uh, they don't feel open. And the doctors that that there are so many like doctors out there, that people nowadays that they are creating like misconceptions, even negative low conceptions, perceptions for about the doctors and their expertise, because they are not communicating their values, and they are not communicating their expertise the way that it can be enhanced, it can be like directly speak to them, right? So there isn't like an communication issues, right? So I found that the branding and like right way to do messaging and like emotional way to telling stories, it's like in you like every practice, or the dentist and the doctors behind them, they have also journey as well, their emotional journey. They have inspired to speak this healthcare, the service they picked, right? They have also some form of inspiration behind, and that creates gap if you don't like connect with them, like following that kind of intuitive process in the branding, when it comes to like doing branding and improving the communication system. What I have seen that they do, right? Back in the day I found that it was like they are just all throwing their doctor's degrees and something like that, which doesn't prove that you understand your patient's pain points. And you don't have, if you like, don't you have a idea, or you have that some form of way that you are like directly communicating with them, that you understand their pains, right? So there are many things that need to be considered, right? When it comes to like doing branding in general. So I found that story is something like that, and building an identity. So it's a it, that was like for me. And a scope and a journey for me to like discovering my value as well, that how you can do that problem solve. So doctors, they have a like intrinsic, like it is a value of they have a value which is like empathy, right? So we use this empathy to enhance that communications that are better atmosphere to understanding the patients, right? I know that it is not my language, but the doctors knows that how they can actually operate that situations, that control that situations to understanding a patient better way, even though there are some like procedure as well, the diagnostic process as well, that identifying, and there are some clinical tests as well to know the persons that what exactly the problem issues there, right? So the first part is like understanding the patients and giving that that and a positive space that you understand the patients actually, that what is actually he is suffering from, and how it can be recovered, and how you like balance and neutralize this situation for him, and you give them hope to like something they can be recovered. It is easy, that is. So I don't know that, but as a like patient's perspective, you know it more better. But as a patient perspective, that I went through that challenges, that it can be like improved through like our visual and verbal communications, that how we actually want to perceive. And even it is like now that it's a business competitive place, becoming the business competitive place, right? Even I had a misconception too, that there is no competition in like in the doctors space like healthcare space, right? Now you can see that in my even in my town as well. So if you go like just walk through like 5 minute or 10 minute distance after the interval, that you will find a private healthcare uh, like diagnostic centers and hospitals and clinics like everywhere, right? So now that for the patients, that it is becoming more and more challenging to find the right persons, because they have no differentiation factors. Their identity is not telling them that what makes them unique, right? And it is also same that I when I started to like experimenting the US dental space, that most of the dentist practices that I saw, that their identity is like 90% identities are visual identities, even like the generic one, because they contact with the marketers and they really don't know. I would not say that it is problem like the marketers, because maybe that you have emphasized on like you only the improving your like website, and you know that it's matter because most of the patients book like appointment on online, use scheduling for purpose, but you are not like emphasizing on your identity and overall branding stuff, right? And the messaging stuff as well, right? So this is way that that your practice remains like the telling the actual values, like you don't understand, and you have the lack of strategy, brand strategy. So I found that even I worked with couple of like doctors as well, so they also that they see the like visual solutions, what they look like, that something that easy, something that like kind of like aesthetic part as well, but they are not aware of like a strategic part. Even they don't care about to like understand this concept as well. So I made a like 30 page presentation for a doctor's and dental clinic, and I showcased them. This was my first like time that I pitched my idea, and it was like I personally so enjoyed to like share this idea, and the way that actual that brand can be humanized, and it can actually speak to their patients, right? And you know that it was a great experience for me, and I had an understanding of my market, that I'm it is not going to happen for me because of the value that I have provided. They are not capable of understanding this. So I found that I had to take a pivotal but I found that because that time I was not have a same confidence that right now I have, because I had to do some of inner work, and I had to do it since I haven't uh, like shift my mindsets and having an entrepreneurial mindset, which is like different mindsets and different kind of skill sets that I need to level up. And that making that shift, that was for me a little hard. So I was like taking time, and in the background I was like trying to develop my skills as well, so that I was taking preparations. And the last 3 years I have been consistently posting on like several platforms like design boards, but still I was not connecting with my ideal like dentist and the practice owners. So after understanding that the business models and lead generation systems, and since I am like trying to position my business, it's a solo business agency, branding and marketing agency model, and I am from like an subcontinent country. To targeting them, it's a little bit of like for me and hard. So I was like finding some partners that if I could like get connected with them authentic way, that it will like I will provide some significant value, that what was like that is my passion, like it is like the problem that I can understand, and I can solve this problem better way. So now I started to like speak, and I started to find my voice, and then I will be like continue my journey of like understanding the space of the challenges and the thing that I do really need to care about this in terms of guiding like solo and small dentist practice owners, that how they can get succeed in their practice. So as initially states that what are the things they really need to care about. Yes, of course, that the digital marketing things that is also matter. But what I really figured out, that my system is like a little bit of different, that how we can leverage our like identity story and the defining that unique value, and having a like content system based around that people are going to connect with you more personalized way, and they are going to you are going to like stay top of their mind. And that was the fact that you really need to know about, right? In that if you like rely on you like every month for like ads, and for like something like that paid advertising, and something, but it is still somehow leaks the connections and the gap of connections of you identifying and connecting your the brand strategic part, that you are also not going to find that inspiration, you are not going to find the meaning of your brand. And then you will like also feel like that you are not doing and not investing your time and effort in the right directions, right? So that's why I just like taking a little bit of time and trying to like connect with those peoples and trying to understand the system. And then I will like even I feel like that I started with the journeys, and I will be like sharing some of my design concepts and design ideas, that how story can be leveraged, and how can a unique identity, and based around that identity, when you build a content system and content idea, that going to attract patients more like uh, without like being a pushy or salesy, but it's speak with there makes a distinctions, and it makes something like that you are more authoritative, you are more skilled and experienced, right? So that's approach that I'm going to like show with you. And even I'm trying to create a course that if it will give you some form of benefits to understanding that how branding can help you like humanize, even using that empathy, that how you understand the patients, and how it can be how it can be used for design as well, right? Design is the most great important part for the business, and then like everywhere, that every kind of thinking that we are trying to make it like a real, that we need to like design these things and we need to create these things. So that was like today's a short like rough and share rough kind of things that I want to like release, reveal my story, because as I am like evolving in this space, since I don't want to feel that I'm delaying, because sometimes I feel like that speaking and sharing my the journey, and forgetting about these things. And this thing was, I feel that it was priority, and I would be feel more free, and I will be focusing on like more advanced thinking, advanced problem, and it will not like pull me to like just share this story, because I love to share story, right? And because I love to create story for others. And when I skip my story part, it kind of like create a mind barrier, like it create a friction in my mind. So after like sharing this story to my ideal audience, it feels me that now I am more free, like I'm more happy, right? And then it will help me to like pick the right next step to what I'm going to share about, and what I will be creating about, and how what are some actions that I will be taking, and that will help me to reach to my ideal audience, even like that. Since I'm like this the like beginning positions in, not I'm beginning positions but in the business stage I'm beginning, but when it comes to like designing and branding stuff, it is that I'm doing for 7+ years now, that all the shift that happened to work with different peoples and different cultures and different region. So that's how I do feel like that I do little bit of preparation, little bit of like build credibility in the space. So I'm just pushing myself a little bit of stuff, like speaking this more often and share this value as much as possible, that help me to also like create a space and create like more podcast related, inviting doctors to understand their problems, how can cost effective way, affordable way that I can solve them the better, so give them the better solutions. And every day it is like, and for me now, that a part of like love, expressing my love, expressing my gratitudes, because the mentality, because the mindsets of promoting my business, promoting, even helping my clients, like showing up every day, this is that I'm going to build an habit that improve my ability of persuasive skills, and my visual presence, that I want to enhance my presence as well. So that helped me, that the over the first years of that I was like doubting myself, that where I will begin, where I will be, where I will do, and how I will get the results. It was so frustrating for me that I haven't give much rewards the journey that I was, but I had to develop my resilience, and that I'm from proud. And when I found that the abundance, and when I found that the right people around me, I feel like more motivated, I feel like more energetic. So that's why I feel like to unstoppable, just focus on like helping dentists and working with them and understanding their problems and getting solved, and building a better brand on, say they can like relax on their focus on their practice, and just do say help more peoples, we help more peoples, invite more people, patients, that right patients, so they can actually get the better treatment, and they can live a healthy life, and all day they will have smile on their face, right? So that smile things is so important. So that's why I just a little bit of forcing myself, even it's important. So sometimes that keeping in mind ourselves, that forcing ourselves, growth doesn't happen like overnight, right? So kind of like you can see, if you like go through my previous post and previous sessions, that you will see that most of the time that I was like fighting with my mindsets and my limiting belief, and that's why just I was just trying this out, that sharing and breaking these negative distractions and the negative beliefs. And so that when I keep continuing those things and fighting with those things, it will help me to like do and stay focused on like my client's business, right? So that was like true story that I really love working with now doctors. It's, I feel like the same missions, not, since I'm not a doctor, but I can do some form of contribution for them. So because more people are going to more aware about their health conditions, their mental and health conditions, and they will get like better treatment, right? So this is kind of like an marketing and the branding that I found, that I can involve in this space, or in this healthcare in dental industry, that I can do a part. Still, I can also help them. So nobody suffered from this, and they can find the right care partner and the right doctors, dentists, in the when it comes to like managing their pain and recovery, right? Getting treatment done, and it can be like there are so many surgical staff also involved in, right? So that's why I'm just trying to like this is I found that my missions and the value of empathy, right? I want to do that like this way. So I was like digesting all of the information related of the system of the business and the building brand that over the years I have gained. Now I want to like implement those things and serving more peoples, serving more doctors, that building genuine brands, and what makes the doubts when it comes to like they take freelancers and expertise from like other country. So what they think and how its process also works, that I would love to also learn from my other friends. I have connected with them. I'm trying to like just get more connected with them and like create a solo like discussions or maybe business meetings, that I can also like how my agency, since I'm right now I'm like everything I'm doing like it's a solo business models, but I am more open to like solve business problems, that bringing some like expertise people so they can also solve their like specific problems better, and I can focus on like my clients and their visions and managing this staff and then serving like a great way that I well, as much as possible, so right. um, so yeah, like I really love that it is in my heart, because of that the journey that led me to working with doctors, and I want to keep continue doing this, and I need your help, I need your support, and I need your feedback as well, right? So more you like share with me the feedback when it comes to like running your practice private, whether it is a private practice, whether you are a founder, whether you are a practice owner, you are a manager. So if you like share with me the details of the challenges when it comes to like that the communication, the story and the identity, the creative part that is still remain like unnoticed, and it is not implementing the not considering giving the much attentions on creative part as well, that healthcare it is kind of like uh, gap of creativity and the emotional connections I see, and lot of businesses is that at the scope of like rebranding things, because the humanization part and the emotional connection part, the establishment of the business identity part as well, it is like still I feel like more generating, still it can be more innovate, right way it can be done. So I will be like I would love to like bring some awesome design and creative projects, that how it can masses better that emotional way that connects with the patients, and it's essentially helps to build a business on like social media, even that whether it is like if further like any need require kind of development in next phase. So I'm open to like help if you are like solo practice owner, running a dental practice and dental office. So I would love to like chat with you, that what are your concerns when it comes to like and what are some challenges that you are facing. So please feel free to reach out. I'm dropping my free consultation booking link in the comment section, so I would love to discuss. And yeah, that was my story. If you love this story, I appreciate you if you want to like share with your friends and family, and if you know any dentist and he is like planning to start his business, right, in general, so he's not have a good budgets on agency mm, right, they're picking like taking the high sales. So I'm just send them to, and highly I would be happy to help them to walk you through the process, that how we can do this, build a better dental clinic or brand, right? So till now, it seems that outside it is coming rain, and it's I need to like close this, finish this recording, and I will be see you in the next video. Bye bye.